The healthcare profession really has identified a need for change. And originally we're promoting physical activity and exercise. We realise now that there's more to it than that. We do live probably in a society at the moment where a lot of individuals are not aware of the need to take care of their own health and well-being. There's a culture of prescriptions and pills. If I get ill, my doctor can fix me. But we know now that if people were taking care of themselves a little bit better, there'll be less need for the pills and the prescriptions. We want practitioners who can have an understanding of the factors that prevent people from engaging in their own health and well-being, that understand the clinical issues, that understand the societal issues, and can potentially sit within a group of healthcare providers and sort of be the conduit, that understands all of the different facets of healthcare. So our program really is set up to kind of take a holistic view of health and well-being of people who are suffering from conditions, such as diabetes, musculoskeletal disorders, cardiovascular disease, essentially preventable type conditions, and look to see how they can manage conditions for themselves. We've got a cancer-based program, a chronic back pain program. We've got a leg ulcer clinic, a diabetes clinic. We get groups of individuals, people who on the back program who've maybe been suffering from lower back pain for a long time. Essentially, I've been through the mill, and they've seen the consultants, they've seen the physios, and essentially they're in a situation where there's not a lot more can be done for them. Essentially, they're left to get on with their life, or told to get on with their life, and they come to Marjon, and we kind of support them in how to do that. And our approach really is talking about what can they do to take responsibility for their own condition, to realise what they can do as opposed to what they can't do, and really try to look at behaviour change, maybe taking responsibility for getting a bit more active, choosing healthier diets, all these small things that contribute to overall health and well-being. We have a strong academic underpinning. Students will learn about the physiological basis of health, psychological basis of health. They will consider sociological perspectives in terms of factors that influence health. The course then is, it's vocationally based. We want our students to be in a position where they know how to interact with healthcare providers, know how to interact with healthcare professionals. So we have lots of opportunities where they will get hands-on experience. We have a number of clinics up at Marjon, and the students have opportunities in their first, second and third year to engage with those clinics to get hands-on experience. We have a number of healthcare providers that we work with, outside of Marjon, and there are a series of projects that we're setting up at the moment. And one of our drives really is to give our students as much an opportunity to get involved with those as is possible.